plan isn't really just about PSI, just like the metric wasn't just about PSI. It's about the people whose lives we're trying to save and improve. And that's how we've attempted to frame this early thinking. Okay, so right now, I'll jump into the first kind of theme that we think might be important going forward. We do a lot of things for Sarah right now. A few of them are on her dress there. By the way, can you make out what is that shape of this thing? Can you make out what this is?
A baby.
Okay, yeah, it's a woman with a baby. Well, you never know. Don't assume. And some people have asked what's on her head. That's a hair bun. Nothing crazy. So we do a lot of things for Sarah now, an incredible amount of things, and we're very proud of that. And only a few of them are on there, beginning with family planning. We even, in Asia, I don't know if you guys knew this, but at one point we were doing diaper boots for Sarah in Burma, which she appreciated. But basically, we believe that we could be doing more for Sarah. And what we found out is that in many parts of the world, like in Asia or Latin America, and actually it's every region of the world, we're not particularly at different levels aligned with her health needs. For example, in Asia or Latin America, HIV, where all much of the funding comes, is one of the lower risks for Sarah, whereas in some countries, tobacco smoke or other non-communicable diseases might be a much greater risk to Sarah. Now, it's not just those countries. In Nigeria, the greatest risk to Sarah is upper respiratory infections. More than malaria, more than HIV. But what are we doing in that area? Nothing. Now, we can't change that overnight. Some of that depends on donors. But we think that we could do a better job of aligning ourselves with her needs, looking at the opportunity from her perspective. And again, this goes back to the health burden data, which we now have, so we can look at her needs. Even around the world, every year we find out that the HIV epidemic is more and more concentrated than we ever thought. And we were too broadly targeting our interventions. I mean, this just happens every year, forever. So that too means aligning ourselves, targeting and aligning ourselves to Sarah's needs. The other thing that this would include in terms of, and it's called, this theme is simply called Follow the Need, which sounds like duh, but in many cases, we're not even reasonably, or at least we're not as well as we could be aligned to her needs. Even with safe water, our tendency, we launched Safe Water Solution. Well, now Des Shabazz is talking about it. Wait a minute, let's look at where diarrhea comes from and look at all the different interventions that could be affecting that, and what would be most effective for Sarah. And it's a lot more than just Safe Water Solution. It's called WASH. So we think there's a real opportunity here, and it includes something else, Follow the Need. It means following Sarah's health-seeking needs. We don't change how she shops for solutions. And because that would be just, you're trying to change, that would be, for the most part, hopeless. We try to make things better of where she's now finding solutions. And that happens to be, for the most part, in the private sector. Even the poorest of poor Sarahs are primarily going to the private sector for solutions. Now, that doesn't mean we only do the private sector. But we want to follow where she's already going and make it better. And that's one of the reasons social franchising is so important to PSI. We're the global leader, and we think there's huge opportunities to do more with that. Because not only does it follow her health-seeking behavior, as good marketers would do, but you can do so many good things for Sarah based on her needs once you have an exposure to her in a clinical setting. So, follow the need. Now, it comes with a few caveats because it's not easy. You can't just say follow the need, change everything. This is nothing that's going to change overnight. And we're talking about a 5-year strategic plan. And again, I'm proposing this to you. There has to be some donor funding. And this is one, people say, well, how can I follow it if donors don't fund it? Well, it's hard. But there are things we can probably do. We can pilot in areas that we think are important. We can maybe at the end of meetings with our stakeholders in countries or globally mention that, by the way, we're not addressing the #1 need in Nigeria. Should we be thinking about that maybe sometime? So it's a long-term kind of approach, but in many cases we think we can improve our programming, even within the programs we have, by being more focused on Sarah's needs and burden. The other thing is we'll only go places where we add incremental value. We're not interested in displacing other NGOs or other work or the public sector or anyone else that's doing good work. We need to add incremental value. We have plenty of things to do. Let's not just do other things that somebody else could be doing as well or better than us. And then the final kind of condition or proposed condition, for now we stay within our health mandate. Because there's been we get a lot of requests to go outside health because of that strong brand positioning, that what we offer, the how. But right now we're staying within health. So, next theme. Also begins with Sarah. And then there's something next to Sarah. That's a PSI platform in the field. And what I've been saying to the platforms at the retreats is, you know what? It's not because you guys are so smart and good looking and talented that you're kind of always talked about as the front line of PSI, or that sometimes we'll say, oh, that's the most important thing, the platform. It's not because they're so good looking or talented. It's because, when we do say it, it's only because they're closest to Sarah. That's why platforms are so important. And yet, there's something in between platforms and Sarah. And behind that curtain, I don't know if you can tell it's a curtain or not. Can you? Yes. I had some great confusion at one retreat about it. Bravo, does that look like a curtain?
Shower curtain.
Shower curtain. Okay, it's a shower curtain. It is a shower curtain, isn't it? Nice catch. With an arrow on it. But behind that curtain is kind of what we do. Well, it's the insight we have into Sarah. So a evidence-based understanding of her needs and behaviors and why the barriers to achieving solutions. And then it's taking that evidence-based insight and applying it to real actions that give her choices that she would not normally have. Now, what do we call that junk I just described? Is there one word that might describe all that you could think of?
Social marketing.
Tina! This is the worst thing. It's marketing. At one retreat, silence. Okay? And I was in such a panic. I look over to Tina, who works in finance. And, Tina, what is it? She said, marketing! It somehow worked out. I don't know how. But it's marketing. Now, we're going to talk more about what's that. Because it's a little confusing. But we think that marketing is a competitive advantage for PSI. And Carl has kind of laid down the challenge to become the best marketing organization in public health. But what does that mean? That's the key, or the question. We think it's the rigor of putting Sarah at the center of what we do. But the question is,